Tariff benefits versus member contributions under the new Social Health Authority continue to spark debate among stakeholders, with concerns that rebates for primary healthcare services are too low, forcing 9 out of 10 Kenyans seeking medical services to pay out of pocket for healthcare. And as Mary Mwoki reports, stakeholders have questioned the scheme's effectiveness in delivering quality healthcare, even as questions abound about the reduced benefits package at odds with the increased member contributions.
Disquiet and discontent continue to simmer among stakeholders over the benefits under the new Social Health Authority, a key concern being the decreased benefits under the new scheme, which are viewed as not commensurate with the premiums contributed. Stakeholders have faulted the government for rolling out SHA without adequate budgetary appropriation.
So primary care is one of the main reasons why there is general dissatisfaction. We have noticed the unpopularity of SHA. It's because outpatient services are not working, are incurring out-of-pocket expenditures. We don't know whether it's a technology issue because you can't claim in the portal, or maybe it is deliberate because the funds are not available.
Each household is allocated 900 shillings per year, with critical care at level 4 to 6 facilities capped between 3,360 and 4,480, with a limit of 180 days, after which the households will be forced to top up any amount that exceeds the above cover limits. In the private sector, group covers allow up to 1 million shillings for inpatient, a development that is sparking outrage among stakeholders who accuse the government of misleading Kenyans regarding the benefits package of the scheme.
You have daily bed rebate of 3,360. In fact, that money is not even enough to cover specialist consultation, for instance. Were we a little bit hoodwinked if we promised Kenyans that there will be 3 baskets: primary health care, funded by Parliament; emergency, chronic and critical illness, funded by Parliament, parliamentary appropriation? Then Kenyans were more comfortable to increase contributions under the SHA fund, knowing very well that primary health care and chronic illnesses will be covered. What has happened is that we are pushing up the contributions by Kenyans under SHA fund, but we are not pushing up the contributions through Parliament under primary care and chronic illnesses.
The Kenya Kwanza administration promised universal health coverage for Kenyans and pledged to eliminate all out-of-pocket payments for health seekers. The Primary Health Care Fund, the Critical Care Fund, and the Emergency Critical Care Fund, which were meant to kick in automatically to cushion members who exhausted the Primary Care Fund. This year's budget allocations tell a different tale. The government allocated 4 billion for the Primary Health Care Fund out of the 50 billion requested for the fund, which caters to 99% of health seekers. For the Emergency and Critical Care Fund, Treasury allocated 2 billion out of the required 75 billion.
2 funds that are supposed to be state funded. That is the Primary Health Care Fund and the Emergency, Chronic and Critical Illnesses Fund. Those 2 funds are largely responsible for most of the problems we have with the transition. The consensus that was arrived at during discussions with stakeholders is not what arrived in the Gazette notice. What arrived in the Gazette notice was something entirely different. It was a whittled down version of what had been discussed by the stakeholders, and the basis under which we believed that even if we increased contributions, the benefits will be able to justify.
President William Ruto has, however, defended the scheme and cautioned critics to stop fighting the project and instead help mobilize Kenyans to register under the new scheme.
Plan yetu ya kusonga mbele iko imara. Musikuwe na wasiwasi. Hawa watu wa uongo, hawa watu wa porojo, hawa watu wa kuendesha propaganda na fake news, tutawaaibisha.
Mary Mwoki, Citizen TV.